Hi, I'm Tyler Bisbee with Cal Baptist University. This is Kinesiology 353, and today I'll be talking to you about athletic injuries and assessments with American football, especially in high school football. See if I can pull up my laser pointer while we do this so we can see what we're talking about. So American football, coached a couple years with freshman football at one of our local high schools in hopes to get to a varsity level coaching job in the future. Some of the injuries that we're looking at, especially in this PowerPoint, are going to be injuries to the cervical spine, to the knee, and to the ankle. Some of the factors that play into this is going to be the level of play that we're talking about from freshman to junior varsity to varsity. Obviously, as we're learning fundamentals at younger ages, the injuries can be there due to the inexperience of the fundamentals. But then as we get up into higher level of play, such as varsity football with juniors and seniors, of course, fundamentals are there, and the amount of pressure and power that can be put into the tackling and the running and things can really play into how these injuries are um, happening. Factors that play into this, again, age is a big determinant. Also, we're looking at factors such as the environment, the wind, the rain, the snow, the heat. Also, environmental factors such as whether we're playing on natural grass or maybe in the sand, like up in Trona, or playing on playing on AstroTurf at some of the newer fields who don't use grass at all. So these are going to be factors that could play into these injuries. So the first injury is going to be the cervical strain. Strain is going to be defined as an injury to the muscle or a tendon, and that's according to Mayo Clinic. As we look here, we can look at some of our GIFs here that are showing some head-to-head contact with the ground, head versus the ground, also player head versus head. So as we're looking at our mechanisms of injury, obviously most of the time traumatic. The head-to-head contact, especially in football today, where we've been trying to take away that head-to-head contact, but also players coming down and hitting their head on the ground, or hyperextending, hyperflexing, or hyper-rotating their neck on the ground or against another person. Usually what happens is we see injuries to the levator scapulae in the neck, long muscle that comes down from the top of the head down into the shoulder. Injuries to the spine can happen anywhere from the C1 to the C7, and these strains are going to take place in those muscles, causing a possible tear or just extending those muscles out and causing an injury. When we have cervical strains, it's common to see pain or tenderness on palpation. There'll be redness and bruising, muscle spasms, limited motion without a good range of motion with the head and neck. Also, swelling is common and weakness to the muscle. When we're assessing this injury, obviously we want to touch, we want to look. We're also going to assess by getting into a local emergency room, doctor's office. And with that, treatment's going to be taking place. Obvious treatments for a cervical strain are going to be ultimately to rule out any kind of fractures to the cervical spine that can cause injuries to the spinal cord. In this case, we know that we have a cervical strain. We're going to figure this out through x-rays of the cervical spine, maybe CAT scans to the cervical spine, and then in our recovery and MRI to determine how bad the injury is to the cervical spine. Other treatments may include a hard or soft collar around the neck to help limit movement until we're ready to start rehabilitation or pre-rehabilitation. It's also important with treatments to start stretching as soon as we can to help decrease our neck stiffness, and that will be determined by the primary care physician. Our preventative exercises, one that I really like is the chin tuck. At the bottom here, we have our video with my son Aiden showing the proper way to do a chin tuck. But a chin tuck exercise is going to be performed while laying flat most of the time, but it can also be performed while sitting or standing. And this just consists of bringing the chin down into the chest and holding it for the amount of seconds that your physical therapist may be prescribing or your orthopedic doctor. In this case, we have 5-second holds. And this is going to help stretch the neck from the base of the neck up into the skull. We're going to repeat this 10 times, and we're going to be using this exercise daily to help stretch out those muscles. Our rehabilitative exercise, this is going to take place after an injury to the cervical spine. And for this one, we're using our active neck side bend. The head should be tipped to the right. We're going to hold those for 15 to 30 seconds, back up straight, and then move it to the other side, holding for 15 to 30 seconds. And this can be repeated 2 to 4 times on each side. And this exercise can be done 2 or 3 times a day, each day, to help relieve pain and to bring back full range of motion. Our next injury is going to be our anterior cruciate ligament tear, very common in American football to see these injuries to the ACL. Our sprain is going to be the stretching or tearing of a ligament. In this case, most of the time we'll see different grades of tear, but we go from a small tear to a complete tear from grade 1 to grade 3. In our video here, we can see some of these hits that we're seeing to the knees, to the legs, causing some kind of warpage to the leg, causing some kind of internal or external rotation that can cause the injury to the ACL. These mechanisms of injury, most of the time going to be knee getting stuck underneath the body, knee coming in contact with the ground, maybe from hyperextension, hyperextending that knee, or rotating like we talked about. That rotation's big. So we can see the injury to the ACL and to the knee in these photos. Sprains, most of the time, are common signs and symptoms of pain, swelling, bruising. We have limited ability to move the affected joint, and a lot of the times an athlete will have a feeling of a pop coming from that ligament when it is injured. The injury is going to be taking place in the ACL. We're going to see this ACL kind of coming off of the femoral epicondyle, coming down and attaching itself to the tibia. And so when we get these twisting actions, we get these tears. Our treatment, most of the time, surgery is going to be a huge thing that's going to take place with ACL injuries. These ACL injuries typically require surgical treatment, according to Jeffrey Johnston, and the surgical treatment would be anterior cruciate ligament reconstructive surgery. Another important treatment that we use, especially pre-surgery, would be is going to be the RICE acronym, which we use for resting, icing, compressing the injury, and elevating that injury so that we can prepare a patient or an athlete for surgery if that's the way that they're going to be going down for their treatment. Preventative exercise, we need to work on both the quadriceps and the hamstrings. It's important that we balance the weightlifting within the two so that the hamstrings can keep up with the quadriceps. Two ways that we can do this is by incorporating walking lunges into our exercise routine. Walking lunges are going to be working on quadriceps, vastus lateralis, vastus intermedialis, the vastus medialis, and then of course the rectus femoris. The walking lunges, we want to do 3 sets of 10, 3 days a week, and this is going to strengthen the quadriceps. The hamstrings, we're going to do 3 sets of 10, 3 days a week, similar to the quadriceps, and with this we'll be using hamstring leans so that we can try to help add strength to those muscles, the semitendinosus, the semimembranosus, and the biceps femoralis. And from there, we have our rehabilitation exercises. Our rehabilitative exercises for a ACL injury. Stationary bike is a really good way to help strengthen that ACL. Stationary bike for range of motion, strength, rehabilitation, according to St. Luke's. Our set reps times per week. 1 to 2 sets are to be performed for 10 to 20 minutes a day. 7 days a week is good. And progression for this post-surgery range of motion is going to be worked on. And once about 100 degrees of flexion of the knee is obtained, strength training can be incorporated into the rehabilitation routine. With a stationary bike, there is no wrong amount of hours that you can put into being on the bike to help strengthen the ACL. So that is a good way to go. Last injury is going to be our bimalleolar fracture. Fracture is going to be a break in a bone or a cartilage, and in this case, we have the bimalleolar fracture, which we'll look at underneath our anatomy and assessment. But we are going to have fractures to the fibula and the lateral malleolus, as well as a fracture in the tibia or the medial malleola. And you can see that here and in this x-ray right over here. These injuries are usually caused with an injury to the ankle. Mechanism of injury would be ankle versus body, ankle versus ground, or an ankle versus hypereversion or inversion. And with our anatomy, like we talked about, we have the tibia and the fibula, and then every once in a while we will see a fracture to the talus, but in this case with the bimalleolar, we're seeing it in the tibia and the fibula and the lateral and medial malleoli. Usually incorporates extreme pain, swelling, and there is possibility of deformity, but not always is there going to be a deformity that'll be seen by the eye. So our assessment is going to incorporate an AP and lateral view of the bones with an x-ray, and then our suspected fractures should be splinted immediately, and then as swelling comes down 3, 5 to possibly 7 days, according to an orthopedic doctor, we will see a short leg cast applied to that injury. We also may see evidence of ligament injury, which we can evaluate with a CAT scan or an MRI. Our treatment for most fractures is going to be a short leg cast. For fractures that are stable with no displacement, that's when we'll see that short leg cast. It is possible to avoid surgery and be placed into that short leg cast, and that will help prevent the bones from moving. If we have displacement or compound fractures to the malleoli, then we're possibly going to see surgery. So surgery would be another treatment that we would see with the leg. Screws and pins and rods may be put in depending on the doctor that's going to be taking care of that injury. Preventative care. The towel calf stretch is something that I picked to help strengthen the ankle joint itself, to hopefully help keep it from becoming injured if we are playing football. Our towel calf stretch is a loop of a towel around the foot, and we're going to pull that back until we feel some of that stretching in our calf or our gastrocnemius muscle, our soleus muscle. And then with this, we want to do 3 sets of 10 with a progression of up to 30 reps, holding those reps for roughly 30 seconds apiece. All right, our rehabilitation exercises are going to be heel raises. And our heel raises, we can do 2 to 3 times a day at 8 to 12 reps per set. And each heel raise should be held for 6 seconds before lowering back down. These are going to be important exercises for also bringing range of motion and strength back to a healed but needs to be rehabilitated ankle fracture. And on that, we have our references, and I really appreciate your time and allowing me to put this PowerPoint together and providing it to you, and I hope you enjoyed it. Thank you very much.